Before we begin, we want to dedicate this episode to someone who meant the world to Converge Media and to this community. 3 years ago, yesterday, Elijah Lewis appeared on one of the very first Community Voices programs. He was in the Converge studio speaking out about his passion, building and uplifting community as part of the Africatown Land Trust. Sadly, this past April in Seattle's Capitol Hill neighborhood, he was murdered while driving in the car with his 9-year-old nephew. While Elijah may no longer be with us here, his words and his mission still resonate. So in the spirit of Elijah Lewis, we are here for a community conversation, one we hope will empower and uplift just the way Elijah would have wanted it.
We need to talk.
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 Artistic expression is truly a threat to the powers that be because it inspires creative thought.
We're all burying our kids right now. It's black male genocide. It's genocide.
I'm tired of funerals. I'm tired of balloon releases for birthdays.
There are black people who brought the current Moderna vaccine to us, to the world.
Community Voices starts now.
Yes, we do need to talk, and we are so glad that you're with us. Welcome to Community Voices on Converge. I'm Angela Poe Russell, your host for tonight's program. Now, I'm not going to lie to you. This is going to be a brutally honest conversation on something that impacts most, if not all of us, especially in the African American community, and that is tobacco, specifically menthol tobacco, that minty flavor that makes it easier to get hooked and harder to quit. As some of you may already know me, I've been a journalist for more than 25 years now, researching numerous topics, interviewing thousands of people. But what I discovered diving into tonight's issue just blew me away. Here's just a sample. Though smoking rates in the US are declining overall, the percentage of smokers who use menthol cigarettes is rising. And you're going to learn later in this show that there are reasons for that. Check this out. In Washington, 56% of Black smokers prefer menthol compared to 20% of whites. Nationally, 85% of Black smokers prefer menthol compared to 35% of white smokers. Now, there's likely a reason for that. Menthol products are more heavily advertised, more widely available, and priced cheaper in Black communities. And we have receipts for that. During this program, you're going to learn this is an intentional tactic. The impact of all of this, Black Americans more likely to die from tobacco-related diseases. Now, because of this and other key findings you'll learn about tonight, the Washington State Department of Health is calling the tobacco industry out as part of a new campaign called They Think They Know You. Take a look at the video that goes with it.
Big Tobacco thinks they know everything. They think they know you, your community, the places you go, and the way that you spend your time. They think they got you all figured out, down to a formula, a calculation based off of numbers of what they think they know. Show them they're wrong. Learn more at theythinktheyknowyou.org.
Okay, so let's have the conversation. Before we get started, one thing we want to make very clear is that this program is not meant to scare or judge anyone. Tonight's Community Voices is designed to just simply give you information so you can support friends or family. And if you smoke, perhaps the resources that you might be looking for if you decide that you want to quit. To help us with tonight's conversation, we have a really cool panel of guests. Deisha Connor is a health educator with the Washington State Department of Health and is the lead for the They Think They Know You campaign. Dr. John Vassell is a fellow of the American College of Physicians, CEO of the Foundation for Healthcare Quality, a clinical associate professor at the WSU Elson S. Floyd College of Medicine, and then Sonora Akitanor is a PhD and a health promotion coordinator for the Tacoma Pierce County Health Department and is part of the Youth Cannabis and Commercial Tobacco Prevention Program. There she is. Someone else really special I want you to meet is Kat Torres. She's a member of Goodwill Missionary Baptist Church. She has a lot to say about this issue, and she quit smoking after 30 years, and you're gonna hear her story. There's her beautiful face. And joining us virtually, yes, we do have a virtual guest tonight. Jarman Leitner is the research director for the Anchor Group and is the founder and president of Harvest Mental Health Services, and she is a mental health advocate. And you're part of this. We would like you to be part of the conversation as well. So please send us your questions, YouTube, Instagram, Facebook, wherever you are. Ask the question, and we have all the experts here who can answer your questions throughout this program. To kick us off, I think it'd be appropriate, Disha, to start with you because you're the lead of this campaign. And I know you've done a number of campaigns over the years. What made you decide that this issue of menthols is something that, look, we need to take on?
Right. Well, as you stated, according to the data, we are heavily impacted by menthol tobacco. And we know that smoking is the leading preventable disease that is impacting the Black community. And so, to be honest, we have been underfunded for tobacco, but recently the state legislature has secured funding and prioritized funding for tobacco cessation and prevention. So now is the best time as ever.
You got the resources, you got the message, and you see there's a problem. Now, one thing I feel like we need to get straight, I think get on the same page, is when we talk about menthol, like for those who, because they may be like, oh, well, I vape or I do this. Like, Dr. Basso, what are we talking about here? Is it just the cigarettes? Is it just the this? What is it?
Well, thanks for the question.
Yes.
Menthol is a substance usually made from peppermint that's added to the tobacco that reduces the amount of irritation that the cigarette smoke causes. So that makes it easier for people to get the smoke into their system without a lot of coughing. And it also sort of gives them a more pleasurable sensation and makes it more likely that they'll stay with it.
That's why they like it so much.
Right.
Yeah. And you relate to that, Kat? Because you did smoke menthols, right?
Yes,
Yeah.
I can relate to that because I think at the time when I started smoking, and menthol was one of the types of cigarettes that I really liked to smoke because it kind of gave you that lift with the menthol, and with when I tried doing regular cigarettes, I didn't get that. Most people would probably say that high from it, but I noticed the difference in the two. And like Dr. Basso said, that they kind of, with the chemicals and everything, it is a harsh type of brand of cigarette because those chemicals cover it. So you don't get that inhaling and the coughing and the wheezing or whatever that goes along with it.
Yeah.
So.
And so, Sonora, I mean, is this something you often have to get straight with people? Like if they're vaping, does that mean they're not taking, if they happen to have a menthol in there, is it making it less harmful?
No. All tobacco products are harmful with the added chemicals. With their addictive, the increased health risks. So whether you're vaping or whether you're using menthol, it's all harmful. And it causes tobacco-related diseases such as cardiovascular disease, various type of cancers. So all these products are unsafe.
And Dr. Basso, I know we talked about why people tend to like it because it seems to reduce, like if you were, let's say, smoking a non-menthol one, you might experience more of the irritation. But if you smoke the one that has the menthol, less so, right? But why is it harder to quit? Like, why does it seem like, what can you tell us from a medical perspective about that?
That's a very good question. And it's not necessarily just the medical perspective.
Mm-hmm.
When we're talking about cigarette smoking and what you're inhaling, we talk about the menthol, we talk about the caffeine, the nicotine, but there are other things you're inhaling. There's paper that's being burned, You're getting the carbon products from that. There are multiple chemicals that you're inhaling. It's not just those two. So that's problematic, and that's one of the reasons why it causes so many health problems. With regard to addiction, and I don't want to go into a whole lot of things about addiction, but it is an addiction.
But we're going to talk about it later.
Yeah,
We're absolutely going to talk about it. Not right now, but a little bit later. Yes.
Right. There are a lot of aspects to addiction which are not just chemical. Part of it starts with the milieu in which you interact with the product. For instance, when I was a kid, when I was in high school, I was not one of the cool kids, right? I was one of
I don't believe that. For 1 second.
I was never one of the cool kids. I was one of the geeky kids, right?
Look at me now.
So I wanted to be one of the cool kids, and the cool kids smoked, right? So that had nothing to do with nicotine or any of that. It was the idea of being one of the cool kids.
I see.
So once you get into it, then it becomes part of sort of a routine, sort of a ritual, a way of relaxing, which again may not have anything specifically to do with the chemicals. It's just kind of the milieu that you find yourself in. It's kind of like food. People say, oh, calories, carbs, protein. No. Food is fellowship, it's family, it's history, it's getting together. It's a similar thing, not quite the same and not quite as extensive with tobacco, but all of those things are part of being quote unquote hooked on tobacco.
Well, and later in the show, we're going to talk about, Kat, we're going to hear your story on how you were able to quit and also offer some resources. But right now I want to bring in our virtual guest, Jarman, because I know she is like dying to jump into this conversation. You're the research director for the Anchor Group. There was a lot of research that went into this campaign. You actually talked to people about menthols and all the things. When you think about all the research and what you found, what was a big takeaway for you on this?
Well, Angela, first I have to go back to just like you said, the process of the research, and it's called qualitative research through focus groups is what we conducted. And the research isn't easy. Again, gathering people together, providing screenings, having to have connections in the community and having those relationships built. And so all of that came into play when it came to conducting this research and executing it. And we were so grateful for the participants that we were able to gather together. We fluctuated between not having enough or more than enough, but settled on 20 participants that gave us some insights into the awareness of the effects of menthol tobacco. And one of the key takeaways for me after hearing all of the barriers and the awareness that the group shared with us, it was just kind of an attitude, Angela, for me of defeat and so many attempts to try to quit, wanting to quit, knowing that it's very difficult, and knowing that those barriers of the tobacco prevalence in the community, as well as other environmental factors are there, and the stress. I think Dr. Vassell mentioned something around the things that we deal with that could attach us to menthol tobacco use. So just that attitude of that, are we ever going to be able to overcome this, because there have been several attempts at quitting.
Really tried. I know this is bad for me. I want to quit and I just can't figure out how. So you mentioned that word defeat.
Yes.
That's a big one.
Absolutely.
Yeah.
And it was felt in the room. I mean, everybody had such a high level of participation and sharing their stories. And you can just hear the disheartening part of it is that, I got involved in it at a young age. It was my peers, it was my environment, or maybe it was family members. And once I got involved, it was hard to quit. Yes, we know the risk. Yes, we know the effects, but it's just not that simple. And it's difficult sometimes to deal with that. And I'm so appreciative of the conversation that we're having today, because we will share resources later on in the show.
Absolutely. You took the words right out of my mouth, because we have someone up here, a living example of being able to do that, and has some advice to share, and also just validating that it is hard. So we're going to talk a little bit more, as you mentioned, about that piece of hope that is there, the information, but also how do we not get young people started down that path in the first place? That's a part of this conversation too.
Absolutely. I mean, prevention is key. You know, if we can keep the youngsters from even starting and even helping them to become more positive influencers in their community. You know, there's a things such as peer pressure. It's not just negative peer pressure, but there's positive peer pressure where we can be a light and hope for people to say, you don't have to go this path. It's not helpful in the long run. Even though it may feel like it's helping, it is definitely harmful.
And speaking of that word, we are going to talk about the impact of this on our health, but also some of the advertising techniques that have been used in our community for decades. And we're going to show the proof. But why don't we take a quick break? And then right after that break, we'll dive into that part of the conversation. We'll check back in with you too, Jarman. And we'll be back in 2 minutes.
Big Tobacco thinks they know everything. They think they know you, your community, the places you go, the way that you spend your time. They think they got you all figured out, down to a formula, a calculation based off of numbers of what they think they know. Show them they're wrong. Learn more at theythinktheyknowyou.org.
1 in every 500 African Americans in the U.S. suffers from sickle cell disease. 1 in 3 African American blood donors is a match for patients with sickle cell. 1 appointment to donate blood with the American Red Cross can help save a life. Will you be that one? Visit redcrossblood.org/ourblood today to schedule an appointment at a location near you.
Hi, I'm Besa Gordon from Converge Media, Hits 106.1 and Back to Besa on Fox 13.
And I'm Buki Gates from Baseball Beyond Borders.
And we are here at T-Mobile Park where on July 7th, they will host the very first ever HBCU Swingman Classic.
That's right, Besa. Ken Griffey Jr., the kid, has rounded up 50 of the very best ball players from HBCUs from all across the country, from schools like Jackson State, Grambling, Southern, FAMU, North Carolina A&T, Alabama State, and many more.
It's literally the All-Star game before the All-Star game, right?
Exactly. And the fact that the very first HBCU Swingman Classic is happening right here in the Emerald City is a big deal.
A big deal indeed. And it sounds like a whole lot of Black college homecoming vibes.
You already know what it is. Don't miss out on this historic opportunity to see the very best of the best Black college baseball players right here at T-Mobile Park on July 7th. Tickets are on sale now at allstargame.com. See you there.
All right, welcome back to Community Voices. I'm Angela Poe Russell, your moderator for tonight. We are talking about menthol tobacco, the impact, what can we do about it? So thank you so much for being with us. We are here to answer your questions or if you want to comment, so just send us one and we'll get it on the air. I want to talk about now the impact of this on our community, specifically the Black community. Dr. Vassal, we gave some statistics at the top of the show. African Americans more likely to die more than any other racial or ethnic group, even though we start smoking later. So can you shed a little bit more light on what do you make of this? It's a big question.
It's a big question because there's so much involved in it beyond just tobacco and smoking. You know, poverty, lack of opportunity, lack of good jobs, the environments that people work in. Pollution. I mean, that's a very big question.
Right.
We're talking specifically about tobacco and more specifically about menthol tobacco, but I want to point out that tobacco is bad, period. And switching from menthol to regular cigarettes it doesn't buy you anything. So the whole idea is not to get involved in smoking anyway. Tobacco, as was mentioned near the top of the show, causes cancer. It causes heart disease. That's probably the biggest thing, the more common thing, and something that Black Americans die of at a higher rate than many others.
Yeah.
So,
and Kat, you had been smoking for, as you said, 30 years, right? What health impacts were you seeing? Because isn't that how your whole journey started? You noticed some changes in your health.
Yes. I started smoking when I was about 18 years old. And it was in the household, it was in relatives, wherever I went, smoking was being done. So you thought it was the norm. You thought that's what society you're supposed to do, what you see others do, that's what you're supposed to do. But then over the years, the continuous smoking, I discovered that, my health was being affected. And I went to the doctor because I started having some symptoms and stuff and discovered that I had Crohn's disease. Part of Crohn's disease was a lot of the bad habits that I was doing as I was growing up. So when I developed Crohn's disease, I realized that I needed to change my habits. I needed to do something different.
Now let me just stop you there for just a moment, because a lot of people wouldn't think like, oh, Crohn's disease, that could be tied to cigarette smoke, really?
Yes, it can be. That, drinking, the partying life. When you're young, you don't think that, 30 years from now, my body's not going to be doing this, but all of that stuff eventually is going to catch up with you. So when I developed it, I realized that one of the things I had to do was start really mentally thinking about, how do I want to get healthy? How do I get off of this? I mean, the information and everything that was out there, to me, it wasn't of value to me because I needed to get here and figure out here what it is that I needed to do. So I basically started working on myself. One of the things that I did was, first of all, I cleaned up my health, a little bit. I mean, it was a gradual process. One of the things that I really put emphasis on was whenever I felt like a cigarette, I would put money in a jar.
How much money?
Whatever the cigarettes, whatever a pack of cigarettes costs, I would put that money in the jar. And after maybe about a month, maybe 2 months, and I looked in that jar, I realized that I had accumulated a little $200 or a little over that. So not only was my health being affected, my finances was also being affected.
So after a month, you would save $200 just from every time you had the urge putting money in there.
Right. And I also, even with doing that, I had to go a step further, because when I got that urge for a cigarette, I needed to figure out, okay, so what else can I do other than just having this urge? Because if I don't do something else, I'm going to go get a cigarette. So I started doing walking. I would call people on the phone and I would talk to them. I had to get my mind busy to get off of that thought of having a cigarette. So, getting into the gyms, talking to people, looking at what my diet needed to be changed into, because if I changed my diet, then I knew that that was another step going forward for me. And I also, one thing that really got to me was I noticed that my skin coloring with smoking. I noticed that my skin coloring was changing. My lips got darker. And I just thought, wow, this is not good. Because when I can see that transformation going on facial and everything else, I knew that something was affecting it, and smoking was part of it, because when you're smoking, while you're blowing out, it's also coming back at you.
Yeah, and there's some research I know that and it's still being debated, as it always happens when there's research. Like, well, we can't verify yet. We're still trying to figure it out. But there's a little, you say where there's smoke, there's fire. There's a little bit of smoke, maybe bad example for this one, but a little bit of smoke. That melanin you tend to hold on to whatever chemical that is, right?
Yes.
Have you all heard this too?
I've heard it as well, that it bonds to the melanin, the menthol bonds to the melanin. So
stay tuned. In 5 years, it's going to all come out. We're going to be like, okay, they knew this. So Nora, when you hear Kat's story, what stands out to you?
What stands out to me about Kat's story is how she recognized what she needed to do to quit, and her journey. She's talking about her journey and what it took for her to get there, and what barriers kind of were in her way. But she kind of stuck with it, and she never gave up until the end of her journey. So she kind of made it through different things, and and she like incorporated a lot of coping skills. Like she said, she liked to walk, and so different things. She talked about changing her thinking. It was all up here in her mind. So changing her thinking, just focusing on herself and her health and what she needed to do for herself and for her health. And it sounds like to me that's what basically got her through her quit journey.
And research supports that some of the things she was doing, you probably didn't know this, that you were just living out the science, that actually works, right, Disha?
Right. There are different I want to refer back to the focus groups that we had. So with Kat's story, it made me think about those. It was pretty much consensus across the board that everyone came to this journey on their own. There was no set reason why today I decided that I want to start this journey to quit. And also the fact that Kat also mentioned, like, it was a process, it was a journey, and she knew that, it wasn't going to be the next day I'm going to quit. So just knowing that I need to set a plan, I have a plan that I'm going to start this journey. Even if I know I'm not stopping tomorrow, maybe I'm going to reduce the amount. I know if I'm feeling triggered, like Kat said, I'm going to call a friend, I'm going to go for a walk. So all these things are set in place, and I'm sure Sonora can speak more also on the resources, on the quitting resources, like such as Quitline, where you could get a coach to help you through these processes. So just, we're going to get to that later.
We're going to
too.
get to that later. Okay.
but it's just a tease, just to say that, there are free resources to help people with their coping skills and when they feel triggered, so that way they don't turn to smoking.
Yes, a quit coach sounds like a really good idea. So we're talking more about that. I want to bring in Jarman, because as we talk about the mental health piece of this, what is being set off in your mind right now as we have this discussion about the mental health part of it? What do you think people misunderstand about the mental part of addiction and being able to get released from it?
I think that, first of all, people miss being self-aware sometimes, just starting with understanding where you are in this process and how you're maintaining the habit, an addiction. And I believe that in Kat's story, as well as what Sonora said, it starts in our thoughts, and we have to think about what we're thinking. And Kat just kind of lived out what we call clinically reframing the way that you're thinking about the cigarette. And then she also implemented some replacement behaviors. That's what she did when she started exercising and talking to other people. So she had support systems in place, and she had healthy coping mechanisms to help her move through her journey. And I believe Kat even shared that it's an ongoing journey. It's like, you may not stop feeling the urge, but you continue to make the choice and keep a commitment to not pick up the cigarette because you understand the side effects of it. So from a mental health perspective, there's psychological dependence, because we're connecting that to the stress. We're connecting that to relaxation and feeling like it's a positive experience, which is outweighing the fact that the results can be negative.
Wow, thank you for sharing that. Okay, I want to transition a minute, because I do think it's important to expose the truth. And not only did you do research, but there is now a body of research to support that certain communities, you think about African Americans, other groups, women, have been targeted by the tobacco industry, and there's a long history behind it. So we put together this little video. It's just 90 seconds that just gives you a snapshot of what we're talking about. So take a look.
African Americans and tobacco go back hundreds of years, when enslaved Africans and Native Americans were forced to work on tobacco farms. And at another turning point in American history, African Americans once again saw themselves targeted by the tobacco industry. In the 1960s, we first see targeted advertising of menthols in Black publications. The ads were identical to ones in other publications, except white models were substituted with Black models. Eventually, the ads evolved into appropriating Black culture and using athletes and other celebrities to promote misleading content. Then, a clear and intentional effort to prey on the Black community. A study of magazines from 1998 to 2002 found Black magazines were almost 10 times as likely to have menthol advertisements than magazines with mostly white readers. Latino magazines were 2.5 times more likely. And in the 70s, when cigarette ads could no longer air on TV, the industry saturated predominantly Black neighborhoods with discount coupons and free samples. In fact, according to the Centers for Disease Control, even today, stores near schools with more Black students are more likely to promote menthol cigarettes through advertising and discounts.
Not only Stanford University, but Black Lives, Black Lungs. It's a documentary. Lincoln Mondi shared some of his video with us and some of his research. So thank you to him. If you have not seen that documentary, Black Lives, Black Lungs, you should absolutely watch it. So I have to tell, we had a discussion prior to this. Many of us on this panel have been impacted. I've lost 4 family members to tobacco lung cancer. Many of you all have also been impacted. But I didn't know I was part of a system. I didn't realize I was part of a system. Like, what have been your reactions to seeing this and knowing what you know about the advertising? Did anyone want to jump in first?
I'll just say I'm the oldest person here, and I'm not surprised. Because, when I was growing up, that's all you saw. It was in all the Black magazines, as you saw on the monitor there. It was a very common thing, menthol cigarettes. That image, that cool image, cool jazz festival, all those things that talked about those products. It was everywhere. It was ubiquitous.
Anything stand out to you, Disha, when you see it? You're like, we're doing our own campaign.
Right. As you stated, we had our conversation and we talked about how everyone has been impacted with our family members using these products. And just to see how deliberate it is, it just makes you want to do more. It makes you want to, find a way to help our communities to, break away from this terrible habit that's causing such harm to our communities.
And Jarman, did you want to jump in on this too? What was your reaction to all of that?
My reaction was that the tobacco industry, they were very strategic, very calculated in their efforts to saturate the Black community with harmful products. And I felt compelled that, our community now, we need to be strategic with how we're going to combat this. We can't control what the tobacco industry is doing, but we can control our choices as individuals and as a community to come together to be more of a positive influence, to help those who are smoking to quit and to prevent those who aren't from getting into it.
If we weren't live right now, I'd be snapping like we do in the spoken word. I was like, say that, Jarman. That's right. We can't control what they do, but we can control what we do. And so speaking of that, can you also shed light on some of the current things or current trends you see happening to target different communities, specifically the Black community? We talked about the historical perspective, some more present day, but can you take us into the now?
Well, the past has affected today. And the tactics that were implemented back then, they continue on. It's generational. And so the market has already been saturated. The tactics have already been implemented. And now it's almost like it's a well-oiled machine, as my grandmother would say. It's running now. The impact is running and it's going on. And it's up to us to stop it. Now that we are aware, now that we've been educated, we can't just stop with knowing. We have to take action. So what are our next action steps? Again, it's going to require the community to come together, everyone to understand that they have a part to be a positive influencer to help reduce the deaths that come along with tobacco related illnesses.
Yeah, and so something we can do, you know, I noticed that in many places in other countries, menthol is banned. And I know they've discussed doing it in the United States. I know some different communities have done different things. So what do you make of this? Like, that's something we can advocate for, right? Getting this banned, would that make a difference from for public health perspective? Did you want to weigh in first, Nora?
Yes, I think it would make a big difference. But I think that what's helpful is that if we could start at the local level, the local government, if we can like get like any initiatives passed or things passed, you know, starting with selling menthol at the point of sale. If we could get that banned and start at the local level, I think that would be very, very helpful. And also, talking to the legislatures and letting them know, and also the FDA, the legislature, the federal government, letting them know how this is impacting our community and how we're losing individuals in our community because of things not being done to help us. You know, a lot of times, you know, I just feel like with this issue of tobacco that our community is not being recognized, and not being recognized for the health disparities, for how it's affecting our community, for how individuals are dying. You know, I think we're just being left behind. It's not a focus, and that's a concern to me.
What's so interesting is, as we noted in the data earlier, that it seemed for a while cigarette smoking had become uncool. Like it had become uncool. And somehow it's like in certain populations, it's become cool again because you have a different delivery system, I guess. Mm-hmm. Does that make sense what I'm saying, Disha? I mean, I'm hearing just talking, I have teenage daughters, and yeah, the vaping thing is real.
It makes perfect sense. Just like Jarman was saying.
They had to find new customers.
Yes. So it's the same system. They're just finding new things, new ways to get around it. As we know, there have been flavor bans, but menthol, the flavor that the Black community gravitates to, still allowed to be sold.
So let me just even highlight that. You said it, and I'm just going to put a yellow highlighter on that. So basically, the government has banned other flavors, but
we're going to leave that one in there.
But we're going to leave the menthol in there.
We'll leave that. And then, you know, like you were saying with your teen daughters, I'm sure you have talked to them about vaping. That's the new cigarette. It's cool. Vape looks cooler. It smells better. You're going to walk in and you're not going to smell cigarette smoke. You'll walk in and smell bubblegum. It's different, you know? So they have to evolve and change.
But it's not less harm. Like it's not a lesser.
No.
Like, oh, this is really bad and this is half bad.
Exactly. So we also did research for our youth communities. We have a vaping campaign. And we learned that youth actually feel like vaping is a safer option because marketing to them tells them that, you know, vaping is a better option than smoking cigarettes. And it's not. It's still nearly 2,000 chemicals in vapes.
What?
So
2,000 chemicals?
Yes. So it's not an alternative. It's not better. And then, of course, you have to think about the effects on youth and their brain that's still developing. You know, they're more irritable. They think that, you know, the vaping is helping them when they feel stressed, but it's not. It's creating more stress, more anxiety, and more issues. So yes.
Okay. I know we have to keep talking because we're in our next segment. We are going to discuss resources, whether it's someone you love who maybe uses tobacco, or maybe you've tried to quit and you're just struggling. We're going to try to help as best we can. So we'll take a quick break and we'll be back in just a moment.
Hey guys, Basic Garden here. Look, I've been seeing your comments. You're trying to get those tickets for the HBCU Swingman Classic. So this is what I did. I am bringing 20 of my closest friends with me to pull up to the HBCU Swingman Classic over at T-Mobile Park, happening July 7th. Real simple to enter. You just want to head on over to whereweconverge.com/swingman. And yes, I did say I am bringing 20 people with me. Make sure you're one of them by entering right now.
Big Tobacco thinks they know everything. They think they know you, your community, the places you go, the way that you spend your time. They think they got you all figured out, down to a formula, a calculation based off of numbers of what they think they know. Show them they're wrong. Learn more at theythinktheyknowyou.org.
I have a dream. That's what Dr. King said. Have gives hope, doesn't it? Because the dream didn't die with Dr. King. It's still here as long as we're here, as long as they're here.
This thing started with a dream, a vision, a little ambition, anticipating what was possible in the midst of improbable. How do we get our team through the South?
We're going to talk about what happened here in 1964. This city was an ugly place to be.
I need you on the battlefield, making sure that one day and one day soon, by the time they are our age, we can all say, "Child, all lives matter," and it be the truth.
Our God is marching on. Glory, hallelujah. Glory, hallelujah. Glory, hallelujah. Glory, hallelujah.
Welcome back to Community Voices. I'm Angela Poe Russell, your host for this conversation surrounding menthol, tobacco, a lot of research done by the Washington State Department of Health. And they have this campaign, They Think They Know You, trying to raise awareness about the tactics being used by the tobacco industry to get people started smoking and really making it harder to quit. Speaking of quitting, we want to talk about quitting. And one thing I do want to clarify, we have been able to set the record straight that vaping, menthol tobacco, just as harmful as the other, but can it be used as a technique to lead towards quitting? Like, is that a technique? Is that a thing? You're looking at me like, no, Angela, no. Do you want to, Kat, you want to say something first?
Well, it's not, you can't trade one for the other. But I do know that there are some people that, they try to quit or they want to quit. And the vaping came in more as a substitute to slow the process down.
Okay.
So instead of smoking maybe 2 or 3 packs of cigarette a week, you get one vape. And that vape will last you a duration of time. So like I said, no smoking is good for you, and the vaping is not as good. It's not better for you either with the cigarette smoking. But some people do use it as a substitute, because with any addiction, you can't just quit cold turkey. Because as soon as you try to do the cold turkey, something comes right back in to make you start all over again. So for some, they look at it as, at least I'm slowing the process down. I'm not smoking a cigarette, but I'm just vaping.
Does that resonate from your research? What can you tell us about that? Do you want to start first, Disha?
Well, from our research, it was with youth. So no one went into detail. Of course, they didn't self-identify if they were, the ones vaping. Mostly with that research, we discussed like their ideas and what they've noticed about their peers. So most reported on like if they noticed peers, vaped and why they thought, peers vape. They never, of course, their youth. So they did not.
Exactly.
Right. So
Okay.
it was a bit different. So I can't speak
to that part.
To that, but maybe with the research that Anchor Group did.
Yes.
I know Kat mentioned it.
Yeah,
so
why don't I check in with Jarman? Dr. Bassel, do you
participants.
want to speak first before I check in with Jarman on the research?
Yes, please. I'm not impressed with vaping as a substitute for cigarettes. And in fact, that's what the companies were saying, that this was a way of easing out of tobacco use. And I'm just not impressed with that. There are medical to nicotine patches, other things like that, with regard to the actual physiological effects of nicotine. And again, as I said before, it's not just the physiological effects. As Kat pointed out, it's the whole milieu, the whole being cool, what's happening around you. You have to substitute, you have to break that. You know, one thing I like that you did is many people find tobacco sort of a reward, but you switch that up and by using the money that you saved as a
I'll
reward.
get a different reward.
Right. I mean, you got to put something in its place. When you say cold turkey, that implies that you just stop and there's nothing in its place. If you substitute something else, like money. That helps to make that transition.
Okay, so you're not impressed. You know it's been used by some. Sonora, what say you in terms of your health educator? What do you know about? Is there a bridging that usually works in this space?
No,
Okay.
I think as Kat said, there's and what was said here, there are vaping is not safe. There are no safe aspects to tobacco products, whether it's e-cigarettes, vaping, smoking cigarettes. There's no safe options. They're all puts individuals at risk. And, especially, right now with vaping and youth, youth are, vaping is increasing among youth, and youth are at increased risk of long-term health risks. And their brain develops up until they're 25. So in other issues as well, youth who vape, you have to look at the reasons why they vape. It could be peer pressure or trauma. It could be trauma. There are so many different reasons and so many consequences to youth who vape. Failing grades and other things, that are in the environment that, causes them stress and causes them to vape. So I think it's finding a way to talk to youth and get them to understand the dangers of vaping.
Yeah. Well, let's bring Jarman into the conversation, because you do have the mental health experience and also as a researcher. And so I do want your perspective on this conversation. If I'm someone who's trying to quit and then you're telling me this is not the bridge, vaping is not my bridge, help us.
Yes. Well, first I would say, as an individual, we have to be brave, and even when we don't feel like it, that we don't have the courage to take the step and the leap to come away from addiction. And as Kat said, it's a process. It's a step. It's not something that is going to happen overnight, but you have to begin with reframing the way that you're thinking, which is exactly what Kat's story is. It's a perfect example of where she changed the way she was thinking about the cigarette, and she started thinking about more positive aspects and ways of her to replace that negative behavior with something more positive. So we have to begin with support and resources. And again, starting with ourselves, understanding ourselves, and mental health services help with that. It helps us to become self-aware. If we already think we know, then it helps us to identify even more, and also provides that support and accountability to get through the process and find what works for you. It's not cookie cutter, Angela. Everybody's not going to go through the same process. Everybody's story is not the same, but we all have hope and can overcome, but we have to start, and so I say, have the courage, be brave to take that step towards cessation.
From the research and mental health perspective, I would love your view on if there's someone we love who is smoking and we're worried about them. I had that experience with my dad. I would put posters on his door. I did all the things. Like I had the one little bumper sticker said, "No butts on the beach," just and none of it worked, So how do we know works when we have a loved one who we really just care about them and care about their health and want to help?
Wow, that's so funny, Angela. I did the same thing with my mother. I mean, gosh, if I could just count the number of tactics that I tried to use to bring to her attention that she needed to stop, and this isn't healthy, but those tactics don't work. We have to be supportive and come in a non-judgmental way. Our research did show us that people don't want to be pressured. They don't want to be badgered into quitting. It is a decision that they have to come to on their own. And we're saying we understand that. We understand that it's your freedom and your right to choose to do it. And that I would say we're here for support. That's exactly how we want to approach people, not trying to control or manipulate their decision, and letting them know that it's a journey, that they have people right here by their side to help walk them through that.
Okay. Well said. Thank you, John.
I agree with her.
I saw you
100%.
nodding. You jumped in. Yes.
Yeah, I agree with her 100% on that, because the one thing that I found out when I was smoking is that the more people told me to stop smoking and how bad it was and everything for me and all of that, it didn't do me any good. It wasn't something that you could force upon me, because it wasn't my decision. That was your decision. So it had to be me making that decision myself, as far as, if you tell me to quit, then that means I'm going to keep smoking until I'm ready to quit. It's a process. It's like any addiction. You can't go through it unless you're ready to do it. Everybody can't keep telling you to do it. You have to go through that experience yourself. And I think that's where my whole story and my journey was all about, was that it needed to be my decision, not my doctors, not my friends, or relatives or anyone else. I had to make that decision to do it myself. And it worked a lot better for me that way.
So the best thing we can do for someone we care about is just to be supportive.
Yeah, that's critical. And you have to continue to be supportive over the long term. You can't tell somebody to quit and they don't quit and then you abandon them. That doesn't work. You've got to stay with them over the long term. On average, they say most people quit on their 6th attempt.
Oh, okay. The 6th attempt.
Yeah.
Okay.
So when they didn't quit the first time, they didn't quit the second time, they didn't quit the third time, that's not the time to give up. You just got to stay with them.
And the research shows most people do want to quit, right?
Yeah.
Right. Most people do want to quit. So since that's the case, I want to go to each of you. What's the best advice that you have for quitting? So maybe Sonora, I'll start with you and we'll just go down the line and check in with Jarman too. We're coming to you, Jarman. Sonora.
The best advice that I can give to individuals is it's not too late to quit, and that quitting is a big deal. And I think, as Kat stated earlier, quitting is a process. And so I would just encourage people to seek out support, like support groups or counseling, or call the state quit line, seek out other resources to educate themselves and to aid them in their quit journey. I think
that
that's
requires
important.
us asking for help.
Yes.
Which I know can be hard for some of us to do. You can do it. What would your best advice be?
I think my best advice would be is that, look at me. Look at my story, the journey that I took. And it was hard, to do it, but take that mindset. If you really, really want to quit, then start within yourself first. Think about your health, really put some money in a jar, like I did, and see what you're spending in the tobacco industry and what you can actually do with that money if it was actually in your pocket. So smoking is not good, but find the process that works best for you.
Well said. Dr. Bassel, what say you?
What she said.
Okay.
Really, Kat said everything that needs to be said. First of all, understand what smoking means to you. Why are you doing it? There's got to be a reason for it. Second, understand that it affects your entire health, all of your health. It's not just one thing. So understand that. Number 3, what are you going to substitute in its place? Because you can't just quit and do nothing. Number 4, have that support system. Who's going to support you as you go through this journey?
I love that. Finish, please. Go ahead.
And 5, it's holistic. It's your whole health. It's your physical health, your mental health. It's all of that. It's not just one thing. I'm going to quit smoking. No, you're going to be healthy in a complete and holistic way.
And in case you're just now joining us, Kat's story is that she quit smoking after 30 years. You had some health issues, and you're doing okay now?
I'm doing great now. I went to the doctor and had a test the other day, and part of what was discovered was that I don't have Crohn's.
What? What? You saved this till the end of the program. So it's not too late. It's not too late.
It's not too late because it's been a battle, for years. And I always felt like the doctors, when I first got Crohn's, they told me that you're going to have to take this medicine for the rest of your life. Well, I needed to prove them wrong. Mm-hmm. And so that's what I did. I figured if I changed things about me and my habits and everything, that eventually I was going to get off that medicine.
Girl, I am so proud of you.
Did.
Yes. Disha.
It's hard act to follow. I'm just, well, congratulations.
I know,
Kat.
right?
The only thing I would add is just that, people need to provide themselves some grace and think about the fact that it is an addiction. So, they do need support. Take it day by day, hour by hour, minute by minute if you have to. And if you, attempt and don't quit the first time, don't give up. Like Dr. Vassell said, it takes more than one attempt, especially when you're dealing with menthol that is extra addictive.
Yeah, so give yourself some grace.
Give yourself some
more
grace.
Than one. Yeah.
It takes more than one time.
Let me check in with Jarman really quick. Jarman, what advice, you've been listening to everyone else in Kat's story, what stands out to you in terms of quick advice for trying to quit?
Well, first, I just want to say that's such a praise report, Kat. Congratulations for that and your journey and those positive outcomes that you're seeing. I would say, number one, that there is hope and the plight is understood. Everyone goes through some type of struggle. It may not be menthol for everyone. I know we're talking about menthol tobacco tonight, but the plight is understood and people are not alone. There are resources and support out here to help. And we have to begin there. We have to start making that individual decision and making that choice to move towards getting away from smoking and also preventing others from also doing it. So I want people to walk away being community minded as well. Like, it doesn't just affect us as individuals, but it affects those around us. We breathe the same air. Even if we live in an apartment, that air is going all through the building. I mean, we have to start considering one another if we want to see a huge change, which is a reduction in these tobacco-related illnesses and deaths that plague our community.
Beautifully said. Okay, we are going to take a quick 1-minute break. And when we come back, we'll tell you more about the resources that Jarman and Disha mentioned and close us out. Be right back.
Big Tobacco thinks they know everything. They think they know you, your community, the places you go, and the way that you spend your time. They think they got you all figured out, down to a formula, a calculation based off of numbers of what they think they know. Show them they're wrong. Learn more at theythinktheyknowyou.org.
Hey, I'm Besa Gordon. You may have heard my voice on Hits 106.1 or seen me on Converge Media, but now I'm coming to TV. I'm hosting the newest show on Fox 13 called Back to Besa. Check us out every weekend for the hottest topics, interviews, the latest trends, and uplifting stories. We're going to have so much fun, and teens, we got you too. Back to Besa Saturday nights, 10:30 on Fox 13, and Sundays at 10 a.m. on Fox 13 Plus.
All right, welcome back to Community Voices. Let's talk resources, because we know that a lot of people want to quit, so we want to make sure you have the info that you need. So Nora, anything you want to let people know about, things they can tap into to help?
Cessation support groups. Check out in your community, look to see if they have a cessation support group. Basically, individuals coming together to share common experiences about tobacco and about their tobacco journey. Also, the State Quit Line.
There's a state quit line.
Yes,
What's
the
number?
Washington State Quit Line. I think it's 1-800 quit.
If we don't know, we
Yes.
can always
And it's
put
on
it.
our website.
Okay.
So,
Yeah, I think it's
that's
1-800
perfect.
quit.
We'll make
Yeah.
sure we post
Okay.
that quit line. Okay.
Yeah, and so the Washington State Quit Line also is a great resource. They have like quit coaches, and also there's an option if individuals, are interested in NRT, nicotine replacement therapy. So there's some options for that. They have
And
other.
that's effective?
Yes.
Okay.
And they have other resources like pamphlets and booklets and things for individuals to read. So that's an option. There may be other resources, such as maybe someone's offering one-on-one counseling support. That's an option. Phone support, phone coaching, a phone sensation, that's also an option. So these are resources that people can tap into in their communities.
Perfect. Disha, you want to tell us a little about how people can get help through
Sure.
the campaign?
Yep. So I'll just add, with our campaign, they think they know you. On the website, they think they know you.org. You can find these resources for cessation and for mental health support. So for the cessation resources, you can see the quit line that Sonora mentioned, Live Vape Free. We also have the Tomorrow Health app. So younger people, younger adults, youth who want to quit vaping.
What's the app?
It's the Tomorrow Health app.
The Tomorrow Health
it
app.
helps with, coping strategies, help you with your triggers, coaching. So there's a whole list of resources for cessation on the website, and then also for mental health, because, we stated we have to talk about the root problems and the root causes as to why we're using these products. So if you go to theythinktheyknowyou.org.
Theythinkttheyknowyou.org.
You can find all of it there.
Perfectly plugged. All right, I'm going to let Jarman have the final word because we're just about out of time. They're going to yank us off the stream. But Jarman, I'm going to let you get the final word. Anything else you want people to know before we...
I just wanted to add that people can always reach out to their health insurance provider. You can call that number and have them connect you with a mental resource provider mental health resource provider that could set you up for an initial consultation, just to start there, just to get the conversation started and getting some, guidance on what your next steps can be. And you can take that first consultation and just ponder it a bit and see where your next steps are. So reaching out to your health insurance provider is a great way to also get connected.
Okay, you cut out for a minute, but it sounds like our health insurance provider might have some resources.
That's right. You can reach out to your health insurance provider and they can connect you with a mental health provider that is accepting new patients.
Okay, it looks like we've lost Jarman. There's a little bit of an audio glitch, but we have so enjoyed being able to have this conversation. Thank you for joining us virtually, Jarman, and thanks to all of you for being part of this conversation. But not only that, just the work you do in the community. I know, Kat, being able to share your story, I know means so much to people watching who may be trying similar things, So thank you for sharing, and you as educators and you in the community, Dr. Vassell. So we just really appreciate your perspective. You're just a great example of how all of us can play a role in this. Yeah. All right. Well, have a great night. Thank you so much for being with us. Thanks for watching. Again, know that there are many more resources. And I think when we look at this issue, it does start with community and us figuring out that we are not a population to be manipulated by any kind of industry. That manipulation stops when we decide that we have had enough. Our community is so much more than one to be manipulated. So please tap in with the Washington State Department of Health. Here at Converge Media, we will always keep the conversation going, and feel free to share this link with someone you know or care about, and let's continue to make a difference on this issue. Have a great night.